I'm throwing open this discussion, inviting Mr. Balwani. I really request the interns also to take the best mileage of this session because, with great people, the point is that they know so much. Unless you ask them that what you can digest and what you really are interested in, you'll not be able to do justice to yourself. So, let us take this opportunity and, invite him to take on the session. Now, with all these things in these kind of four posers we have here, and I think the screen will be in front of you. Just, take your points or note something. But
Yeah.
So, when SD or Mr. Tiwari told me about sharing my thoughts with you all, and he suggested this topic of beyond strategy, and he also uh, put a few posers which you saw in the previous slide. But I sort of read that and then I kept it at the back of my mind, and I then started thinking about, what does one mean by beyond strategy? I guess all of you have gone through all the standard books on strategy. You also prepared business plans, which is broadly about strategy to begin with. So I was just saying that let's go beyond strategy. Just to go beyond strategy, let's just take a pause and say that what is strategy? And while books are written on strategy, and there are so many things we can talk about strategy, from my simple perspective, these are the three questions. Just to understand where are we now, you understand what your strengths are, what your weaknesses are, what your competitors are doing. So you understand the current landscape and you say, this is where I am today. And then you say, this is where I want to go. You have your vision statement and you say, okay, in 3 years, in 5 years, whatever, you create a broad horizon and say that this is where I am today and that is where I want to go in the next X number of years. And then you come to the strategy and say, how do we get there? What do I have to do along the way to be able to reach that destination which I have set? For me, that is broadly strategy. So then after strategy, let's see what is beyond strategy. Can you go to the next slide? So I then thought of this word VUCA. I'm sure all of you have read and heard about this term. And it is so very true today that we live in a VUCA world. But I think as a strategic thinker, I think instead of getting bogged down with the word VUCA or the term VUCA, I thought let's turn it into a positive frame of mind and say, yes, I understand that I am in an environment which is volatile, which is uncertain, which is complex, and which is ambiguous. But at the same time, what can be my VUCA? Can I sit down and be bogged down and worry about these uncertainties or volatilities or complexities or ambiguities in the world? Definitely not. I have a business to run and I have a business to grow. So I termed another VUCA, that when it is volatile, what are my demands? Is to have vision. And how do I create a vision? You have a vision to begin with, but you continuously ascertain where you are and you continuously keep the vision in mind in your horizon, and to be able to continue to probe what is changing in the environment and to be taking actions to be able to still continue your path of reaching your goal. As against uncertainty, I think what is required is understanding, getting different perspectives of what is happening around you, listening to people, listening to your customers, listening to what everybody is doing around you, and getting different perspectives to understand really, is it really uncertain or there can be really some understanding. Complexity, I think, things can be as complex as you want to be, but I'm sure, I think all of you will understand that through that complexity, one must have clarity. One must continue to look and be focused on what you want to achieve. You must have the flexibility along the way, and you should be creative in terms of how you will be able to navigate through the complexity. And the fourth VUCA is ambiguity. And I think how do you overcome ambiguity? The demand is to be agile, to be able to be agile in decision making, to be agile in terms of innovation. So you continuously try to, even though you're in a VUCA world, you have to be able to navigate and steer your ship to be able to take your company or your function which you are doing along that path. Can we go to the next slide? Yeah. So what's really happening around us? When I started thinking about talking to all of you, I said, so many things are changing. I mean, I've got, most of you are relatively quite young and have not seen what was happening, 50 years ago. My father was a medical doctor, and then he was in pharmaceutical industry. And if I look at the healthcare environment, so much is changing. There was a time when I was a kid where the diagnosis of diabetes was that when somebody goes and urinates in the bathroom and you see ants coming towards that, and you say, oh, this person has got high blood sugar. That was the diagnosis. Today, I have a nephew, my brother's son in the US. He has got two instruments attached to his body. He's a type 1 diabetic, and he has two things attached to his body. On the one side, he's got a monitor, 24/7. It monitors the blood sugar in his body. On the other side, he's got an insulin pump, and both talk to each other. So he can eat whatever he wants. He can do whatever he wants. He does not have to take any oral medication. All that he does is that whenever he eats something which is high in sugar, that monitor will trigger a response to that glucose pump, the insulin pump, and be able to pump in that much insulin into the body to keep his blood sugar normal. It's such an amazing evolution. In India, it's not yet fully come, but here also you can have your 24/7 monitoring of your blood sugar linked to your mobile phone, and you can see on a 24/7 basis how your blood sugar is going. So many changes have happened. There is so much of change in terms of information available to people. People are becoming more aware of health. They are more aware of, what are the new things happening in the field of diagnostics, in the field of treatment, in the field of preventive medicine. Everybody is glued on to the internet. And so many times I hear, doctors saying that, oh, these patients come to me, they've already checked everything, and they come and then question me in terms of what is this and what is that. So the entire healthcare system is getting so disruptive because of so many changes happening, whether it is aging population, more people becoming more aware of what is happening around them, including their health. Costs of healthcare are increasing so much. Today, if a person is diagnosed with COVID-19 and he goes to a hospital to get just mostly quarantine, but a certain amount of therapy, there are bills running into lakhs of rupees, and it's very difficult to understand what's really happening in terms of cost. Who's bearing these costs? Everybody does not have health insurance. Everybody cannot afford these kind of costs, but so much is changing. Diagnostics are changing. I was meeting somebody recently. He's got a small instrument which he says you put the finger on that scanner and it can give you a host of parameters of your body, which otherwise would take maybe a few days to get and a visit to the hospital. So much is changing around the world. And I think the whole environment is changing. While on the side of what it was, people were generally reactive and dependent on traditional facilities and acute interventions. When you had a problem, you went to a doctor and then you got yourself treated. Now what's happening is proactive management of health. People know that, okay, my calcium levels, my vitamin D levels have to be such, I need to spend so much time in the sun, and all kinds of preventive and proactive measures are being taken by individuals to manage their health. So the focus has shifted from the healthcare provider to the healthcare receiver. Can you go to the next slide? So, yeah. So what is happening for a healthcare provider, a pharmaceutical company? Traditionally, when I'd started and a few other of my colleagues were there in the industry, we used to talk primarily about what is the sales happening this month, what is the market share, how much profit have we made, what are we doing in terms of activities, in terms of marketing, regulatory activities, medical affairs. These were the typical uh, discussion points within pharma industry. Now what has happened is that we don't talk about these things which drive your sales and your profit. The focus has now shifted in terms of discussion that what is the kind of value you're providing to the patient, to the doctor, to the health insurance company, what kind of medical evidence are we providing to the patient as well as to the doctor. Are we doing value based discussions in terms of we are not a pharmaceutical company providing a treatment, but we are a company which is providing value to a patient, value to a doctor, a value to a payer, usually a health insurance company. So shall we go to the next slide? So when you look around you and say that, there is so much changing, it's mind boggling in terms of the kind of changes which are happening. At least for me, I see that over the last several years, every day almost something is changing. There is a new value-based healthcare paradigm, which will come from digitally enabled patient services. Everything is going electronic. I mean, there was a time when there was no such thing as a mobile phone. And when they came, they were very expensive. Today, you see almost everybody is on a digital platform, especially now when the lockdown is going on because of the COVID. Everybody is on the internet. Everybody is on WhatsApp. Everybody is on all these Zoom calls or geo calls or whatever we have. Everybody is digitally connected. And one has to see that what's really going to happen with all this digital transformation which is happening. How is it going to impact the healthcare provider as well as the healthcare receiver? So today we have value propositions which focus on clinical attributes of products and say that my product is better than XYZ competitor. But what is really emerging is that when I talk to a healthcare provider today, I'm talking about delivering outcomes-based health, therapy management services, which is enabled through various devices, sensors, services, social engagement, and broadly aware solutions. So we have to understand this world. It may not be everybody today, but it's moving in that direction, that everybody is being interconnected. There is a confluence of forces, whether it is economic, social, and technological. It's compelling changes to everyone's role in healthcare. So individuals, which is patients like us, healthcare providers, doctors, nurses, pharmacists, health insurers, whether it is the Mediclaim policies, the ESIC, the CGHS, all these companies which insure with healthcare, policymakers, which is the government, regulators, which is the FDA, companies which are innovators in terms of bringing up new forms of treatment. This individual healthcare providers, health insurance, all of them have to consider that what is going to really change from today to the future. Next slide, please. So somebody said healthcare is on the brink of disruption. I would say it is already in the process of being disrupted. Every day there is something new happening. New performance and value-focused business and operating models will be required. We cannot have the traditional model of just producing certain products and then going to doctors and telling them that my product is better than a competitor product in terms of features and maybe benefits, and say that therefore you prescribe my product. So one has to see that one has to be more innovative. You can be, bring about new products through faster screening of molecules, faster implementation of clinical trials, doctor-patient interactions will be better. I have a friend of mine who's a doctor who has been now promoting his own services through WhatsApp, saying that anytime you want any consultation, please connect with me on WhatsApp. I will charge you 50% of my uh, consultation fees, and I will give you all the advice that I could give you face to face. If there is any diagnostic required, I will ask you to go to a lab and get yourself tested. You show me the results, and I will give you advice in terms of what is to be done. So all this is so much changing. I think the power is coming more and more to patients. Today, one can go on various apps like Practo and others and be able to screen which doctor I want to go to, which lab I want to go to. There are ratings. If I have a problem with my eye, I can go to Practo and choose ophthalmologist near me. I can, see their rating, what other people have rated. I can therefore then decide whom I want to go to, and then fix up an appointment. And then now, even today, because of COVID, I can even connect on the phone. And there are so many tools available where the doctor can inspect me and be able to make a diagnosis, and if required, send me for some further tests. So many things are getting disrupted. So what are the imperatives to thrive in this new environment? There are strategic choices no healthcare company can avoid. We have to clarify their company's marketing positioning regarding patient outcomes and value to the healthcare system. So when one creates a mission and values of a company, one has to keep in mind it has to be oriented towards what is in it for the patient. One has to define the differentiating capabilities necessary to deliver on those goals. Everybody cannot be doing the same thing. So one has to have some differentiation between one and the other company. And of course, create a high performance enterprise of partners, collaborators, and talent. Next. So based on what I was reading a book on disrupting healthcare, and what they said is that overall, over a period of time, 4 business models will emerge to drive this shift from being a volume-oriented company to a value-oriented company. And they said there are 4 categories of companies or business models that will arise. One is called around the patient innovators. So this is focused on getting yourself focused on the patient. The economics will be tied to improving patient and health systems by achieved by integrating the therapeutics, the devices and services with clinical management process. The second category is lean innovators. For them, it is a more cost-oriented model. They will try to make themselves most efficient in terms of seeing that the manufacturing is done at the best possible cost. There'll be a lean supply chain and collaboration, M&As, mergers and acquisitions, but alliances is a better word. Alliances with various stakeholders to be able to deliver your services or products to the user in the most cost-effective manner. The third is new health digitals. So this will be grounded in terms of digital and global scale and the ecosystems of using apps, using technologies, using devices, and the cloud is going to be all leveraged in terms of being able to deliver a value to the patient. The fourth is value innovators. These are product centric, but focused on how one can provide the inputs to a patient journey and using various outcomes and analytics to be able to make the patient feel that I am getting value. I've just listed 4 examples. One is personalized medicine. There will come a time, I'm sure it's already started in certain countries, where if I have a certain problem and I need a certain treatment, it will be very personalized in terms of what I will get, both in terms of diagnostics, in terms of medicine, in terms of patient care. The entire works will be fully done primarily putting only that particular individual patient in mind. The second emerging thing which I think will happen is, we all are very familiar with Amazon, and we already see a trend where companies like Amazon will enter the healthcare space. And they are now looking very actively at, today already certain products like even Volsante products, you can go on Amazon and see, but there will come a time when if I have e-pharmacies are already there, but I look at this that instead of having so many e-pharmacies in a country like India, ultimately one day there will be a large global enterprise like Amazon, which will provide you all kinds of medicines. Third is, we are all again familiar with Uber and Ola. Now, actually, just to take an example of where I live, there are about 5 to 6 retail chemists which are in the walking distance of maybe 5 to 10 minutes. Now, it does not make sense to have so many pharmacies across. And at some point of time, I think this will become like Uber. You will have somebody who will say, okay, what you want, you tell me. There's no need of having so many retail pharmacies. I will pick it up and provide it to you. There is a person I know in Africa. What he's done is he's created a company where all the retail pharmacies as well as stockists are all members of his organization. He then goes to pharmaceutical companies and says, look, I've got a bunch of 10,000, I don't know the exact number, but say, let's take 10,000 pharmacies who will buy through me. So they will stop buying from you, but I will negotiate with you what kind of price that I will buy from you. And I will supply to these retail pharmacies and they will then sell your products. Otherwise, your product will not be available in these retail pharmacies. So there's so much of change which is happening around the world. I'm sure it will happen in India as well. Interestingly, I just read about this 3D printed drug. I fully not understood this, but I just read that there is a product which is for epilepsy called Spiritam from a company called Aprecia, which was approved by the US FDA in 2015. Now, this is a 3D printed drug. It is taking a liquid, and on top of that liquid, you just spray some powdered medicine. And when you put it into your mouth, it instantly dissolves and goes inside. So all kinds of changes are happening in terms of drug delivery, in terms of technology and everything. So now I just want to change a little bit in terms of gear and say, okay, we are looking at this environment which is changing so rapidly, and I think we need to keep thinking about it. I just want to touch on another topic about ideas. If we have to move a little more out of the box and to be able to change our gears, to be able to leverage this changes in the environment, I think I just thought I'll create one slide on ideas and creativity. So when I have interactions within pharmaceutical companies today and in the past, you have people coming up with ideas, and it is very important to be able to understand which ideas are going to give you what result. So the first thing is wrong ideas. There is no one who deliberately says that, okay, let us do something like this, which everybody knows is the wrong idea. Everybody thinks that when they propose an idea, it's always from that person's perspective a good idea. But one has to see whether those ideas are really going to fulfill your desired objective. So there's an example given by Stephen Covey in his book saying that a person climbing efficiently on a ladder can keep climbing on the ladder and achieve the end of the ladder. But he later realizes that the ladder was actually leaning against the wrong wall. So it's very important to understand that one should be able to sift the wrong ideas out of what you're considering. Then there are types of ideas which are a dime a dozen ideas. So everybody can come up with ideas, and one should understand that mediocre ideas will give you mediocre results. There's this old thing which I learned in advertising in my younger days was this statement by David Ogilvy. And he said, it is not creative unless it sells. So just having an idea is not enough unless it's actually going to improve your market share. So it's very important to have ideas which actually help you to achieve your goals. Then there is the third concept of good ideas. Now, this is very easy for people to get into. People say, oh, this is a good idea, let's do it. But you have to resist the temptation and be able to say that I don't want to be good. I want to be great. And there are articles written about from good to greatness. Many people do good things, but that doesn't take you to another level. It will keep business as usual, but one has to focus on great ideas. And it is important to try to develop in your organization people who give you great ideas. How do you get great ideas? The next slide is culture. Satyaji mentioned about this statement from Peter Drucker, which says, culture eats strategy for breakfast. And Mr. Bhandari will talk later about execution. And I guess execution eats strategy for lunch. And I don't know what eats strategy for dinner, maybe people. But I guess it is very important to start, because whatever strategy you make in an organization, unless you have the right culture inside the company, it is a make or break issue. And this is really the culture which separates you from the competition in the marketplace. I've had a personal experience, more than one, where it has worked both ways. I've had an environment, a culture, which has gone and resulted in certain not good things happening. I've also had cultures in the organization where it has resulted in great things happening. And it is important to focus on culture and see that the organization is built around, creating the right culture in an organization. We'll talk a little bit more about it. But it says culture functions like an operating system of a computer. It provides the definitive process environment for operability of the strategy. So, again, I was looking at corporate culture. What is it? It's a system whereby people share values, have common assumptions, common beliefs, and norms that unite the members of an organization into one. This is a very easy statement to make on paper, but it's a very difficult thing to achieve in real life. To have everybody having shared values, assumptions, because each one of us comes from different environments, different experiences, different backgrounds, and it is very challenging to be able to create a corporate culture which is, so aligned to each other. Everybody in the company is aligned to each other. So it's a good thing to put it as a definition, but it's very important to understand that there are challenges. But it's very important to at least keep this in mind, that unless you have the right cultural thrust, all your internal activities may be in diverse directions, and you will have a disjointed company and not be able to achieve your goals. Next slide. So I have prepared a few slides in terms of, as an individual or as an observer, how do you measure or observe or try to determine what are the cultural expressions of the company? So one set of cultural expressions is length of workday. I have seen so many companies where people don't have a work-life balance. They are spending more hours than necessary. And I had one boss who told me that if you do not leave on time, either you're inefficient or you're overworked. In either case, let us discuss. But I don't want to see you in office beyond office hours. And this is something which I remember till this day, and I've tried to practice it and say that I don't want to see people working beyond office hours, barring exceptions, maybe on some days in the month. But otherwise, the length of workday is important. Internal communication is important. And many companies have an internal communication department, and there are internal house journals where people start sharing thoughts and ideas and views with each other through internal communication, either through written or verbal or group discussions. External communication is also important. How the company projects itself to the outside world, again, is very important to create a culture. Style of dress, you have different kinds of companies. I'm sure you are all young. You have seen all kinds of companies, the startups having very informal wear to the very formally dressed companies. And I think this also is an expression of culture. A reputation of the CEO is very important in terms of setting a benchmark in terms of what determines how a culture of a company gets evolved. The staff turnover is important. How many people leave the company, and definitely for what reasons, is very important to understand. The lower the staff turnover, the more cohesive or aligned are the people generally. And work-life balance we talked about. Then cultural expressions, slide 2, is again a lot of factors which will determine the culture. One is professionalism. We hear now about nepotism in the film industry and all that. But it's very important that in companies, people remain professional. Not that you don't have any light activities, but the focus when you're having meetings, when you're having discussions, is very important to focus on the work rather than talk about other things. Physical facilities, all of you are aware, the good lighting, good space, keeping distance from each other, having more openness in the organization, all those, the physical aspects of the company also are important. Value for employees, what do they get out of this? And this can be, things like income, which is very important value for the employee. It is also in terms of learning, in terms of job rotation, in terms of progression in the hierarchy of the organization. All these are value for the employees. The employee morale, how do you deal with each other? Are you motivated? Do you talk to your boss frequently? Do you have good interaction with your colleagues? All those determine employee morale. Risk evaluation for decision making. There are some companies which punish you very hardly if you've taken a wrong decision. So, one has to always be able to evaluate whether the decision was taken in the right spirit and no ultimately without risk. So it's important to evaluate that. Ethical compliance is very important. There are a lot of companies who turn a blind eye to certain things which are non-compliant. So it's very important to keep that in mind. And intrapreneurship, allow people to take decisions, give them scope to do certain things which are a little bit out of the box and try to take risks and learn certain new things. Next. Then one more slide on cultural expression. I think it's innovation inside the company is important, how you encourage people to try to do new things. Inclination to organization goals, see that everybody understands the company vision, mission, the goals, and be able to align yourself. Plainness of structure. It's as most books you must have read on HR, they say the flatter the organization, the better the communication internally, and more scope for performance related. Then evaluation of employee evaluation practices. It's very important to recognize good performance. If somebody has not performed well, to be able to understand why and to be able to provide the person with good feedback in terms of how things can evolve to be able to make the person perform better. Then relationship between colleagues, the relationship between the senior management to junior management, standard of the organization values, esprit de corps, which is basically feeling part of one team. It's a term derived from the army, and say you have a spirit of being all together. Gender philosophy, you should not be able to differentiate in terms of gender. That's very important.
Hello.
Other things like,
Hello. Hi. हाँ बोल ना.
Ashni, you should put your thing on mute. So these are further things about cultural expressions, and I will not go through each one of them because of time. I will go next to the last slide, which is the next slide. It's very important to align the business strategy with corporate culture. So in effect, the whole goal for aligning the business strategy with corporate culture is to ensure that the components of the active culture within the organization will facilitate us to be able to operate our strategies which we have agreed upon. It's like a glue which brings everybody together in the form of collective energy, and be able to fasten your organization to the way things have always been, and move forward in terms of achieving goals. So that was my thoughts in, I think I overshot in terms of time, but just wanted to share my thoughts with you, and understand if you have any questions at this stage or afterwards.
Thank you so much, Mr. Balwani. In fact, the way you think, the way you, uh, you know, put forth all these uh, broader perspectives of important things, which probably even the interns might find it very useful when they enter the corporate world. This really was a great introduction to them. You took this topic of beyond strategy, really beyond the expectation, where you certainly covered the breakfast, lunch, and the dinner. I think there are many such elements which are there, because yeah, strategy does get eaten away by culture, by people, by execution issues.